Hi YouTube community, my name is Dr. Ben. This video is a vulnerable share of my journey over the last 2 years. As we're now entering March 2022, that means I can look back 24 months, 2 years to when I made my first YouTube video. I had been working as an audiologist for a few years in Northern California, and let me share this story with you, if you have about 10 minutes, of how I created Treble Health, formerly known as Pure Tinnitus, and how it started with a single YouTube video. Well, if I think back further than the YouTube video, it started with a single patient. I was working during my residency for audiology in San Francisco, California, at UCSF, University of California, San Francisco Medical Center. I was shooting for the stars, trying to get into the most competitive residency that I could. And after going to graduate school in San Francisco, I was accepted and amazed to be entered into the residency at UCSF. Now, 6 months in, I was working as an audiologist doing tinnitus consultations as a tinnitus expert. It was one of my passions to help people through this process and to help them get better. What I saw was that one person on my schedule showed up, and I looked at their name in our computer, and it said that they were living in Lake Tahoe, which is a 4-hour drive from San Francisco. So I saw that and I wanted to confirm and ask with the patient. And they said, yes, I'm coming from Lake Tahoe. I went to my local doctor. They told me that there's nothing they could do for me. I saw you online at UCSF that you had a program for tinnitus, and I was so excited to get some real help for this. So they drove 4 hours and we spent about an hour doing our initial tinnitus appointment at UCSF, and I helped the patient. And they really enjoyed what we were doing. We were focusing on the foundations of tinnitus, the foundations of habituation, and it was a lot of education about how to manage this and how to improve it. After that appointment, the patient was thankful and had perceived a lot of benefit just from that one session. He said, oh, I'm so glad to know that this tinnitus is not something very dangerous, that I can manage this, that I have a plan, and that I know what to do for my next steps. At that moment, that was the seed that was the original prediction of Pure Tinnitus and Treble Health, because I realized that if a patient's willing to drive 4 hours each way to talk to a tinnitus expert, then there's a real demand for experts to go to the home of people all over the country and all over the world, but particularly in the United States. And I have a passion for technology. I was living in Northern California. I was living in San Francisco area. A lot of my friends worked in the technology space, and I connected the dots. If I wanted to become a tinnitus expert and I saw the potential of technology, then it made total sense to start a company that is technology first and video appointments first telehealth company, and pair that with tinnitus care. Now, a few years later, I actually had the courage and the bravery to start recording my first video and start a business. Right at that time, as I had my camera equipment, as I had things lined up, ready to start, I had a beginning website starting to be built. We heard that there was this virus going around and things were starting to close down. Well, just at that time, COVID pandemic began. And I had 2 straight months of living in an apartment with a few roommates. I was single at the time. I had no car, and I was living in Berkeley, California in the Bay Area, which was on lockdown. Also, my job where I was working at a clinic did not want me to come in. For about 2 months, I didn't really go into the clinic. So I had about 2 months where I was focused on making videos every single day. I was learning, how can I use YouTube as a platform to become a tinnitus expert? I already was an audiologist that specialized in tinnitus. I wanted to go deeper, and I wanted to use YouTube as my format to do so. So that's what I did. I spent day after day focusing, building, understanding, learning, getting better, making videos, no one responding, not many people seeing them, but I knew that I would commit to this. And I told myself, this might take 5 years, but I'm going to keep making videos to get this offering to the point where I'll be able to be a full-time telehealth audiologist. A few weeks after I really started to go deep into the video world and how to make videos in the YouTube world, I was taking this course, and it really showed me that I could do it. I got so emotional. I went on a bike ride in Berkeley. I went on a bike ride in my neighborhood, and I felt tears start to come into my eyes. I felt this sense of freedom. For a few years, my stress, my anxiety was wrapped around having student loans, having hundreds of thousands of dollars of student loans from school, and not wanting to work in a clinic for the rest of my life, not wanting to work in a hospital for the rest of my life. But I remember going on this bike ride, and I felt hope. I felt the possibility that I could learn how to make my own business and have that freedom, the freedom to let go of this stress and anxiety about loans and student loans. Now, I relate that sense of freedom and that sense of hope and that sense of awe to what is possible with tinnitus. It's a similar process of learning, working, allowing time to help us. And then by the end of it, through habituation to tinnitus, my patients feel a sense of freedom from tinnitus, a sense of hope, and a more clear vision of their future, feeling more aligned with how they want to live, where tinnitus is not a symptom in their life as much. I'm happy to share that story. Now, the months continued on. I kept working at it. It was about 1 year after I started that I felt like there was some real traction happening, and that I had the confidence to go half-time at my day job. And then soon after that, I quit to work full-time on my company. And previously it was called Pure Tinnitus, because the vision I had was basically so that I personally could have video consultations helping people. And then I could travel, I could spend time with family, I could live in a different place. And that was my vision. The feedback I got from the community was so strong. My schedule started to be booked or completely full. And I had to ask myself, well, what should I do? Should I charge more for my services? Should I bring on another audiologist? Or should I go for the online course format and turn these methods into an online course that someone can do on their own? Thought about that long and hard. And the answer really is, what's best for you? What's best for the patient? And the best option for the patient is not to make it more expensive. It's not to make an online course. It's to have a team of audiologists that can do the same service, same quality as me, just a different style with their own unique flair and their own clinical perspectives. So then we hired our first team member. I hired Dr. Michelle, and she started October 2021. And then soon after that, we hired another audiologist, and the company started to grow. Around that time, we switched from Pure Tinnitus to Treble Health. And now, in the last 4 or 6 months, this has been our focus. Treble Health, where we're still having a very serious focus on tinnitus care. And we're also working with hearing aids and providing consultation on getting the right tinnitus treatment and getting the right hearing aids. Very happy to announce that my older brother, Garrett, who's also an audiologist, who had worked in New York City at a private practice, a private clinic for about 5 years, he joined Treble Health full-time in February 2022, around the time making this video. So now we have a family-run business that is focused on providing the best care possible for tinnitus and hearing loss via telehealth. I'm extremely proud of this journey, and there were ups and downs. At times I was frustrated, at times I wanted to give up, at times it was really hard to help some patients. But you know what I've learned? I've learned that I'm here to do my best. I'm here to show up and work hard, and I cannot guarantee an improvement for every single tinnitus patient. But we can do our best. We can continue to provide a roadmap and a guide, and we will not give up on you. Our team, myself, will not give up on you during your process of habituation, during your improvement to tinnitus. So excited to continue to be a part of this community, to work with technology, and to move our profession forward so that individuals with these conditions of hearing, of tinnitus, can have the right kind of care that they need and can access it conveniently through technology. I have a lot of passion for what I do, and I really cannot be here and to make this video if it was not for the YouTube community, for you watching. So please let me know who you are. Leave a comment in a few sentences of who you are, what's going on in your life, where you live, and I'll do my best to reply. Thank you for watching this video. Give it a thumbs up if it connected with you. I enjoyed sharing this story, and I hope you have a wonderful day. And if you ever need help with tinnitus or hearing, please reach out to our team at Treble Health. Thank you so much. Bye.